Good morning, everybody. Thank you so much for joining us today. Just a little about me. I'm actually a two-time graduate from Mason. So as a Patriot, I'm super excited to be here. And I wish I had known about Money Smart Day when I was a student, because I definitely would have clocked in. We're going to talk about the very, very basics of health insurance. And I just kind of want to get a read from you guys. If you could just drop in the chat on a scale of 1 to 5, like 5 being the most confident, 1 being the least, like how do you feel right now about your knowledge of health insurance? Just the basics, nothing overly complicated. Twos, okay, that's fine. We're gonna hopefully we're gonna get that up to at least a 4 today. All right, so feel free to drop a word in the chat if you want to about what you feel when you hear health insurance. I can tell you a couple that I've heard before: scary, daunting, complicated, confusing, right? And yeah, health insurance can be a little complicated. It can be a little confusing. And a lot of times, like, you don't know who to go to or who to ask. Or how all of the little interworkings go together. But again, hopefully we're going to get that cleared up. I want to start with a video. If anyone watches Dr. Glaucom Flecken on TikTok, he's one of my favorite TikTokers. But he did a little how US health insurance works. It's essentially everything that I'm going to talk about consolidated. So you could have probably watched this and like known, but we're going to start with that and then we'll get into it.
It's a bit hard to hear, Stephanie. It sounds like really quiet.
Say that again, John?
Sorry, it's a bit hard to hear. It sounds like very, very low, very quiet.
Let me turn that up. Sorry.
It's fine. Yeah, it's still silent.
Technical difficulties. We're going to get in.
If you get a chance to, go ahead and take a look at this video. Link is down there. But let's start getting into health insurance. So today, the goals for today is defining common health insurance terms, learning the basics of how health insurance works, and identifying the options of when you can enroll in health insurance and how to do it. So the very first thing that we're going to get into is defining what a premium and a deductible is. So when you buy your insurance or you sign up for your insurance, there's a fee that comes with it. And every month you pay what's called a premium. The premium is what you pay to have health insurance. And I know that sounds weird that you have to pay to just have the insurance, because you also have to reach this deductible before your insurance starts to work. So you pay a monthly premium, and a lot of times your employer will pay part of that premium. And that premium says, hey, health insurance, this person is covered under you. And health insurance goes, okay, we'll start paying for their services once they reach their deductible. The deductible is simply the amount you have to pay before the insurance will pay for you. They don't pay for, your deductible doesn't include every single thing that you pay. Your premium does not count towards your deductible. Co-pays do count towards your deductible. And there are a couple of other things that do, but there are also services that deductibles don't apply for. So you pay your month to month. They say, okay, you have health insurance, and then you pay out of pocket money in order to get them to start cost sharing with you and paying. And we'll go ahead and talk about cost sharing in a second. But The big thing to know is that when you reach your deductible, your health insurance will start helping to pay for a lot of your services. And a lot of times that deductible can be about, $1,000, $600, $700, depending on the plan you get. But once you reach that deductible, insurance will help pay. Before you reach your deductible, say you go and get blood drawn and the blood draw costs $310. Insurance isn't going to cover that yet because you haven't met your deductible, but you pay that 300 and something dollars for your blood work and say your deductible was $300. Well, boom, you've just paid your deductible and now health insurance will start covering the other part of it going forward. When you pay your premium, again, you're paying for a health insurance plan, covered preventative health care, and discounted services from in-network providers. And we'll go a little more in depth about what an in-network provider is a little later. But covered preventative health care. Back when the Affordable Care Act got passed, it included these covered preventative health care services. There are mandates for certain ones that have to be covered, and then other insurances can pick and choose which are a couple of the other ones that they don't want to. Some of the preventative health care that is covered is going to be an annual physical. It's going to be mammograms for women, prostate exams for men, anything that is a preventative service or a screening to either keep you from getting sick or ensure that you are not currently sick with specific diseases. And again, there are certain ones that are mandated for all health insurances to have, and there are others that health insurance can pick and choose. And like I said, deductible won't be paid at every visit. It's all in one lump sum over the course of several visits. And then the big thing to note about a deductible is that your deductible will reset every year. Every calendar year, your deductible will pop back up. So say you got your health insurance in January, you paid your $500 deductible by February, and then next January comes around, you now have to pay that $500 deductible again in order for health insurance to cut in and start taking some of it. But again, once you reach that deductible, your health insurance starts covering your cost, and that's called cost sharing. Cost sharing is the process where you pay a little bit and your health insurance pays a little bit. And depending on plans, you can have something called a copay or a co-insurance, but a lot of times you'll have both for different things. When you get health insurance or when you have health insurance, if you go on to the website that your health insurance provider has, you will have a summary of benefits, and that is something that will lay everything out. Student Health Services at George Mason, we also have our own health insurance plan, and we have a summary of benefits that you can get in clinic. You can call our insurance office and ask for it. It's also available online, and that'll kind of show you what it should look like, even if you don't have this insurance, but it gives you an idea of what it is. So what's the difference between a copay and your co-insurance? Just drop in the chat if you've ever gone to the doctor and they said, okay, pay me 25 bucks. I'm sure a lot of people have done it, right? And then you go to another doctor and that doctor says, hey, give me $35. And then you leave, you had a physical or whatever it was, and then you paid nothing else and you left. Well, that's your copay. Your copay is just the simple amount that you pay each time for your service, and it's set. It's typically about $25 for your primary care, and then $35 or $45 for the specialists. But a copay, I like to think of copays as I pay for the visit. I go to the doctor, I pay the copay. And co-insurance is more of the I get a service, it's the cost of the service. Co-insurance is a percentage of the cost that you pay that the health insurance does not pay. So say I go to the doctor and I've met my deductible. So I'm going to go and get a test and it costs $100. Well, my co-insurance for that test is 20% of the cost. So I'm going to pay $20 and my health insurance is going to pay $80. And that's great, right? Because you don't have to pay the big lump sum. Your health insurance pays the big part. But if you hadn't met your deductible, you're going to pay that full 100. A lot of people get confused by copay and coinsurance, and I'll be really honest with you guys. I was confused about copay and coinsurance for a really long time. So don't get caught up if you can't, if you're having trouble understanding it. But really the big difference is copay is a fixed amount to see a doctor, and coinsurance is the percentage of a cost that you pay for a service. Typically, that's going to look like that 80-20 example that I gave you. Your health insurance is going to pay about 80% and you're going to pay about 20%. That keeps costs on you low, right? Let me say I have a pre-existing condition and I have to see an endocrinologist. Am I protected from having to pay the specialist copay? I don't believe so. That is decided by the insurance company, but I believe typically, even if you have the pre-existing condition, a specialist is still a specialist, so you're going to pay the specialist copay. I hope that answers your question. So, out-of-pocket maximums. When you pay out of pocket, right, you pay that $20 for that test, you have a maximum amount of money every year that you will ever spend out of pocket. And it's typically a pretty high number, right? So you pay your deductible, your $500, and then you keep paying more and more money, and say you've paid $7,000 out of your for all of your healthcare costs in the year, and that's your out-of-pocket maximum. Well, guess what? Now everything is completely covered. The most you pay varies by plan. It depends on who your provider is. It depends on the plan from the provider. And not everything that you pay will go towards that out-of-pocket maximum. So again, your premium, what you pay every month for health insurance, is not going to go into that program. I'm sorry, into that maximum. So again, another way that you can find out what costs are going to go into that out-of-pocket maximum, that go towards that maximum, that's going to be in your summary of benefits. And that's typically available on your insurer's website. Does the out-of-pocket maximum make sense to everyone? You pay X amount of money and insurance is like, all right, you've paid enough. I'm going to pay everything now. Fantastic. I forgot to mention this before. If you have a question now, please drop it in the chat. There will also be time for more questions later on. I mentioned earlier that when you pay your premium, you are getting a discounted rate to see in-network providers. So what is the difference between in-network, out-of-network? What does it mean? How do I decide? We're going to get into the nitty-gritty here. So the network of providers is set by your insurance. Your insurance company has contracts with hospitals, doctors' offices, all other practices that say, hey, when people who have my insurance go to see you, you're going to give them a lower rate for their copay, right? So that comes into that specialist, and that specialists in network, out of network, things like that. So in network is doctors, healthcare facilities, other providers that have that agreement with the health insurance program that you have. And as a result, you pay less money out of pocket. Your insurance says you can see all of these people and you'll only pay $25 per visit, or $35 if it's a specialist. But if your insurance does not have a contract with that provider, that is considered an out-of-network provider. And typically you'll pay more out of pocket for that, depending on your insurance. Another thing to note, and we'll touch on it a little bit later, is that there are certain plans that allow you to have out-of-network providers, and there are certain plans that don't let you unless it's under certain circumstances, and we'll talk about it. But the in-network providers have the less out-of-pocket costs. It's typically less of a copay for PCPs and specialists, your primary care providers and specialists. And it'll just be a little bit higher for the out-of-network ones. Sometimes I've seen before that there are providers who maybe don't take insurance, like a lot of therapists will not take insurance, but it's reimbursable. So if that is something that you come across, you'll have to check with your insurance company that you can submit that claim, and then they'll reimburse you for a certain percentage of costs because it's technically considered out of network, right? But really the big difference between in-network and out of network is who has a contract with my doctor and who doesn't. And you know, sometimes it does matter to people, sometimes it doesn't. Other people are okay with just going with whoever they can find. Other people are like, no, I'm really particular and it happens to be out of network, so I'll do it. So it's a matter of personal preference about if in network versus out of network really matters to you. But also there are a couple of things to consider when you're considering seeing a out of network provider. Question in the chat. How do you find out which doctors are in network or not? Very good question, Anna. So you will be able to find that information on your insurance provider's website. Typically, if you go in and you log in, there will be a little button that says find a provider, and you can then search by practice. If you already have a doctor and you're trying to see if they're under them, you can search by the name, the specialty, but also you can call the doctor's office and say, hey, do you guys take Anthem, Blue Cross Blue Shield? Can I come see you? And if they say, oh, they're not in network, you can still see them if your insurance allows you to see out of network providers. Does that answer your question, Anna? Awesome, fantastic. So again, when you're considering an out-of-network provider, does your plan cover the out-of-network care? That's a big question because cost is very important to people. MRIs, x-rays, surgeries, all of that kind of stuff can cost thousands of dollars. And if your insurance doesn't cover that out-of-network plan, you might get stuck with that bill. So it's really important to think about that. Another important thing is, do you need a referral from your primary care provider to see an out-of-network provider? And a lot of times that depends on the type of plan that you have. Again, we'll hit on that. Specifically, like an HMO plan is going to be the big one for that. It's really important to ask these questions before you're picking these things, because you want to make sure that you're making the most informed decision about your health care. Are there in-network providers near you? If the only thing around you is out-of-network providers and the nearest in-network provider is 4 hours away and your insurance covers out-of-network, you can definitely go and see an out-of-network person for convenience. But that's also something to consider when you're picking your plan. So taking a look at what's around you when you're looking at the different plans is also really important. But if you're thinking about seeing an out-of-network provider, you can always ask yourself, is there an in-network provider near me that can do exactly what I want without having to go out of network? And then, are there any exclusions? Again, this is something that you have to check in your summary of benefits with your insurance company. And it will tell you if there are any services that you can't see out of network, any specialties that you can't see out of network. Again, do you need a referral? If you don't have a referral and you need it, that's an exclusion for that kind of care. So these are the big 4 questions to ask yourself when you're considering seeing an in-network provider or an out-of-network provider, or when picking a type of plan. I was going to do polls, but they ended up getting messed up. So I am just going to ask for some basic interaction in the chat, and you do not have to answer if you don't want to, but they're just going to be true or false questions. Okay, so the first question that I have for you guys is true or false. The copay is the percentage of a cost that you pay to your insurance. Give you guys a few seconds. got a false, I've got a true. Anybody else want to answer? False. I'll give it another second. So the answer is false. The copay is not your percentage. The copay is always going to be that straight billed $25 to see your primary care doctor. Next question, true or false? The deductible is how much you pay out of pocket before your insurance starts to pay for your costs. True, trues, anyone else? That is true. Great job. Yes. So your deductible is going to be what you have to hit for insurance to pay part of your insurance, part of your costs. And then when you hit your out-of-pocket maximum, that's when your insurance company is going to start paying for 100% of your services. True or false? Your premium is the amount of money that you have to pay to have health insurance. True, true. So that is true. So that is always true. So the premium is just your monthly payment to your insurance company that says, hey, keep insuring me so I can have health insurance. A lot of times that'll come out of your paycheck if it's through your job, if you have Social Security benefits and you're getting it through another, like a public or a social program, excuse me, it'll come from that. But so the premium is just always how much you're going to pay in order to be insured. You guys did great. That was really good. Awesome. So now we're going to talk about the different types of health plans. We're not going to go super in depth for this, but I really wanted to take a look at like the most common ones and say, hey, these are some things you may see when you're looking through insurance, deciding which one you want to get. So these are like the most common terms that I've seen. There are other plans that are out there. You have your preferred provider organization or a PPO, a health maintenance organization, which is your HMO, or you have a high deductible health plan that you can get with, that you can add a health savings account to. So the health savings account is not a plan, but it goes next, it goes with the high deductible health plan. We're just going to go over them real fast. So PPOs are going to have your higher monthly premium and higher out of monthly costs, but what it does is that it'll allow you to see out of network providers. And a lot of times you can see that out of network provider without a referral. You can just decide, hey, I don't like this PCP that's in network and the guy next door is out of network, so I'm going to go see him. And that out of network is going to be covered, but you might just pay a little bit more than you would pay for those in network costs. The next is the HMO. HMOs typically are a little bit cheaper. They have lower monthly costs, lower out of pocket costs, but the caveat to that is that you are pretty much stuck with your in-network providers. In order to see an out-of-network provider with an HMO, you have to get a referral from your primary care doctor. And without that referral, your services may not be covered. The difference between the PPO and the HMO, big differences. PPO is more expensive, but you get to see the out-of-network providers without a referral. The HMO is a little bit cheaper, and you may be able to see a specialist or an out-of-network provider, excuse me, with a referral from your doctor. And now we're going to talk about the cheapest option. So these kind of go in order from most expensive to least expensive. The high deductible health plan. So we talked about a deductible, right? That is, let me see what this question is. Oh, there wasn't a question. So with the high deductible health plan, we talked about what a deductible is. It's a high deductible in these health plans. And I like to kind of call these plans cross your fingers plans, because you have these kind of plans when you're like, I'm totally healthy. Nothing really is going to happen to me. And if something does, I just want some insurance. So your high deductible health plan is going to cost less per month, right? So each month your premium is going to be really, really low, but you're going to have really, really high out-of-pocket costs. These plans come as both HMOs and PPOs. You can get one to see out-of-network providers. You can get one with just your HMO. And it's typically for, like I said, for people who want to save on health insurance and then they don't need frequent care. So when you're 21 years old and you're like, I'm completely healthy, I don't have a lot of health needs, I don't have monthly prescriptions, and I don't want to pay a lot of money for health insurance that I'm never going to use, a high deductible health plan might be what you're going to use, what you're going to go for. Is there only one type of Medicaid that gets distributed to those who qualify? We will talk about that briefly, and I'll also provide some resources on where to look into that, but we'll touch on it in a little bit and I'll get back to it. So with a high deductible health plan, you can get something called a health savings account. A health savings account takes money from your paycheck and puts it in this little savings account. And that money is there if you get in a car accident and break your arm and you have to pay for health services, you now have this little bucket of money that you've been putting aside because your health insurance isn't paying that much money, right? That amount deposited is tax deductible, so you'll have to report it on your taxes, but it will help to lower your overall healthcare costs. A lot of times people hear the health savings account and a health flexible spending account or an FSA and think they're the same thing, and they're really not. I didn't touch on it here, but the FSA is a flexible spending account that does the same thing as the HSA. It takes pre-tax money out of your paycheck and puts it aside for you to use for your health insurance costs. But the big difference is that the health savings plan, all that money that you put in there, if you don't spend all of it, it goes into the next year, it just rolls over. With the FSA, it does not. It's use it or lose it. Can you have an HSA along with regular insurance from your employer? Good question, Lydia. No. So the HSA is only available with the high deductible health plan. If you wanted something like an HSA with when you say regular insurance, I assume you mean like a PPO or an HMO. Yes, you can have the flexible spending account, and that'll take money out of your account and it'll give you a little card and you can use it later on. I hope that answers the question. So just a quick review, PPOs, they're really cheap. You can see whoever you want. You don't need a referral. I'm sorry, PPOs are expensive. You can see whoever you want. It doesn't have to be in network or out of network, and you pay just a little bit more. The HMOs are typically cheaper. You're limited to your in-network providers. If you want to see a specialist or an out-of-network provider, you need a referral. HDHP is going to have the lowest percentage. The lowest premium and the highest cost, and then you can add an HSA to that at the end. So I know that was really quick, and I don't expect you guys to know all of the information. Yes, thank you. HSAs can be used for basically anything that you buy at a pharmacy, and there is a list online from like healthcare.gov or healthinsurance.gov that will have all that information as well. And CVS has one. Will the PowerPoint be available after the presentation for the audience?
Oh, we can make it available. Yeah, we can. If the audience would like it, yeah, we could handle that. Yep.
Great.
Mhm.
Awesome.
And then Stephanie, one more question about is an HSA the same as a health reimbursement arrangement? Was higher up in the chat. Yeah.
So sorry, I missed that question. I'm actually not sure. I'm not familiar with health reimbursement arrangements. So I'm sorry, I don't have an answer for you. But that is something to like check with whatever insurance company you're looking into to double check. So I wanted to play a little game, and you guys don't have to worry about if you get it wrong or right, or if you want to answer anything, because it was a lot of information on the last slide. But I kind of wanted to see like All right, we just talked about different health insurance plans. Maybe let's think about who would want what plan. So take a look at Daniel. Daniel's 41, he has a wife and 3 kids. 2 of his kids have special medical needs, and he wants freedom in choosing his provider. Would Daniel want a PPO where you have higher costs, but you can see whoever you want? An HMO where the costs are a little bit lower, but you're restricted? Or a HDHP where you're going to have to pay most of it out of pocket? Give it a couple seconds for some more answers. PPO. Yes, it is a PPO. Great job. Daniel would best want a PPO. He has 2 kids that need special medical needs. They're going to need to see specialists. They don't always have to want to fumble with the referrals. And he wants to choose whatever provider he wants just because he likes them better than the other. So PPO is going to be a really good plan for Daniel. Next, we'll look at Anya. Anya's 22. She just graduated college. She's in great health, no special medical needs, and she doesn't want to pay for something she rarely uses. So what is she going to look at? Does she want the PPO that's more expensive, the HMO that's less, or the cheapest option, the HDHP? Yep. Anya is going to want that HDHP, and she can decide if she wants to add a health savings account to that at the end. But she's going to go with that HDHP, and she's going to keep her fingers crossed that nothing happens to her in the next year. But hopefully if she gets that HSA and something does, it's got enough money in it that it will cover those costs. I did want to mention something real quickly about the HSAs. The HSAs and the FSAs do have a cap. Like you can only put so much money into them. So make sure to double check when you're enrolling in those services to make sure that you're not over filling it, because there can be like penalties for that. So just be careful with those. And lastly, we're going to look at Judy. Judy's 63. Her kids are out of the house. She and her husband are perfectly fine health-wise. All they need is that 1 physical a year, and they keep their costs low, but she wants to be able to see a specialist if needed. So what is Judy going to want? And I'm sure everyone knows the answer. Does she want the HMO that's cheaper, but can't see anyone that she wants to without a referral? Does she want the PPO? She can see whatever she wants. Or the HDHP? HMO, right? So Judy wants the HMO. These are things to really consider when you're thinking about what health insurance you want. So that's also kind of the reason that I wanted to do this. I wanted to see if the things were sticking, and I wanted to give you guys those skills to like kind of analyze and see what's going on. Like I said, there are other types of health insurance plans, like an EPO is one of them, but I'm not super familiar on it. And it's not a very common plan either. From my experience, these are the 3 most common ones. And when you're going through your insurance, you'll be able to like see what some of that cost looks like, cost sharing looks like under each different one. And keep in mind that not all PPOs are the same. So an Anthem PPO can be very different from an Aetna PPO. An Aetna HMO can be very different from an Anthem HMO. They all have like different, you'll pay a co-insurance for one thing under Aetna and then just a copay for the same thing under Anthem. So just make sure to look through that summary of benefits or look through the plan benefits when you're picking and keep those things into account. So now I want to talk about how to get health insurance. And there's a couple of ways. The first one is to be under your parents' health insurance until you're 26 years old. So when the Affordable Care Act came on, it said, hey, until you turn 26, you have a right to health insurance. So you can be on your parents' insurance until you're 26 years old. I was on my parents' insurance until I was 23, and it was the best because I never had to think about anything. I just kind of went and did it. And then I had to pick my own, and I was terrified. But so that's one of the main ways that people get insurance. They go on their parent and guardian's health insurance until they're 26. The other one is through your employer. You get a new job and you can say, hey, job, you're going to pay for my health. You're going to help me pay for my health insurance. So you'll go, when you get a job, you'll go through the whole onboarding process. They'll say, hey, here are your options for health insurance. You pay this much a month, we'll pay the rest. for your premium, and then you'll be insured under the plans. Next you have the health insurance marketplace. That is private plans where they go, and government sponsored plans where they go for people who maybe don't have a job or can't go on their parents' insurance, to say, hey, like, you can buy insurance through us, through the marketplace. And the other option is through your university or college. So like I said, George Mason has a health plan for any students who are interested. But so those are the main ways that you can get health insurance. And then there's Medicaid. Medicaid is essentially just a need-based public insurance program. It can be free depending, it can be low cost depending. And yes, Medicaid does have different plans. You can get Medicaid under Kaiser, Aetna, multiple different plans. I think some of them have HMOs versus PPOs. Those are all available, but again, they'll have different costs that you'll have to, if you don't qualify for free, it'll have a different cost. Because Medicaid is need-based, there is a household income limit for it. But if you were curious about if you are eligible for Medicaid, you'll go to coverva.org. There's the full link there at the bottom, /en/am I eligible. Or you can just go to coverva.org and there will be a button that says, am I eligible for Medicaid? And it'll walk you through the process. When can you enroll in insurance? Well, there's open enrollment. Insurance says, okay, from this time to this time, you can enroll with me. And during that time, like, you can change how much you want to add to your HDHP. You can change the type of plan you have if you have any extensions on your plan. So that's the open enrollment period. Insurance says, all right, from here to here, you can enroll in health insurance. Well, what happens when open enrollment is closed, right? There are certain circumstances in which you are able to enroll in health insurance or make changes to your health insurance when it's not open enrollment. And those are called significant life events. A couple of those big ones are going to be, you just had a baby, you just got married, or when you get a job. So you quit one job and now you have no insurance. And then you get another job. So you're going to enroll in insurance then. So there are these different significant life events in which you are eligible to enroll or make changes to your health insurance. My mom files me as a dependent. She does not have insurance. Am I able to get Medicaid for myself, or does she have to get it? I'm not sure. I think because you're filed as a dependent, your mother would have to, but you can go through that website, the coverva.org, and it'll have those questions answered. That's a really good question. Thank you for asking. So there's different times when you can enroll, and it's just important that you do it in a timely manner if you have a significant life event like having a baby, because there's limits for how long you have after having a baby or getting married to make those changes. Other considerations when you're picking your health insurance plan. So we talked with HMOs, PPOs, HDHPs, we talked about health needs, right? Like if you don't need a lot of care and you're pretty healthy, keep that in mind. And then that goes into that frequency and types of healthcare visits. If you're always seeing specialists and you like the ability to go and see it in an out-of-network provider, you may want to go with the PPO over it. Income and monthly budget, HDHPs are really, really cheap, but if you're frequently seeing doctors, an HDHP may not be right for you. We also have your dental and vision. So a lot of places, they will have dental and vision as its own package or two separate packages, and then health insurance as its own package, or it will all be combined. So if you want dental and vision insurance, you have to double check hey, when I'm enrolling in the health insurance, do they have a dental and vision extension or addition that I can add on? And then if it doesn't, then hopefully there are other options for the dental and vision. And dental and vision plans are relatively cheaper than their premiums are relatively cheaper, but they work the same way as other health insurances. Other considerations like any dependents. Do you have kids? Are your parents your legal dependents, and do they need more freedom in who they pick and things like that? And again, you have that fingers crossed plan, the HDHP. Hope and hope and hope and cross your fingers that nothing happens. But if you decide to go with that plan, make sure that you have either an HSA or some other type of savings to help combat those costs. This is what a health insurance card looks like. I just wanted to give you guys this image. A lot of times it will like, not a lot of times, it should typically list like your cost of your copay. So here it says $25 for a primary care provider and $40 for a specialist. You have the plan type listed on there. We have HMOs and PPOs. You also have the two other plans that I was talking about, a POS and an EPO. But it will say, it won't have like all four of them. It will say whichever one it is, and then health plan. It'll have the name of your insurance, your member ID, and the group number. Group numbers is just like, hey, this is the exact insurance plan I have. If you ever get your insurance card and it has like, oh, it is on this one. So like your RX BIN number and your RX PCN number, that's just, hey, this is the prescription part of my health insurance that tells the pharmacy where to send the bill. And on the back of your insurance card, you're always going to have numbers for your providers to call if they have insurance questions, or for you to call if you have a question. Say, hey, like, why did you guys not accept my prior authorization for my medication that my doctor prescribed me? So they'll have all of that information there on the card. And then you can get that more detailed information on the website in your summary of benefits. I went ahead and listed some resources here for you guys. So healthcare.gov has this really awesome glossary where if you're going through health insurance plan and you don't understand what something means, like, hey, it's right there. Other resources is going to be your health insurance company. You can go to their website, you can call them to ask your questions and get a better idea of your benefits. And then if you're on your parents' insurance, you can talk to your parents and say, hey, like, how does our health insurance work for this? And what happens if I need this? And can I see an out-of-network provider? Hopefully your parents will be able to give you that information. And again, if you have questions about the Mason student plan, you can contact the Student Health Services insurance office for questions. And they'll be able to give you more specific information about what is covered under our plan, what the percentages are, those co-insurance percentages and co-pays and things like that. So I'm going to take time for other questions for the last like 15 minutes that we have today. So if you guys have any other questions, please drop it in the chat. I'm also going to pop this QR code on here. If you guys get a minute, if you could please take that quick survey. We just want to make sure that the information we're teaching makes sense. It's like 6 questions. So if you get a chance, please do that. And then if you want more tips on insurance or health in general, please follow Student Health Services on our many social medias. Let me take a look at this question. I found with the savings on premium monthly payments after a year that the HDHP costs the same as the other insurances, plus no cost prescriptions, costs and other benefits. Oh, okay. Yeah, I mean, I guess it depends on the how often you use it and things like that. But I think typically they tend to just be a little cheaper. So yeah, make sure to do the math. That's really good advice. Thank you. Oh, didn't mean to do that one. Sorry. If you guys have any questions, my email is on the previous slide. It's just sfunkau@gmu.edu. So please feel free to email me. But these slides will be available to you later. So basically the HSA and HDP are connected. You can't have one without the other. That's correct, right? So an HDHP is your health savings plan, right? So you can continue to add money into that and it saves, it goes over and over and over, and it's only available with the high deductible plan because it's designed for you to have savings to cover your healthcare costs if your fingers crossed doesn't work out. But when I mentioned the flexible spending account, those can't go with the HDHP. Those can only go with the other services like a PPO or an HMO. And the main difference between the HSA and the FSA is that the FSA is use it or lose it. Every year when you hit that end of the year cycle, whatever money you don't spend is going to get lost. So you want to make sure that you're always spending it. Whereas in the HSA, you want to make sure that you're saving it as often as possible. I mentioned prior authorizations earlier, and I feel like that is a big question mark in health insurance. People are like, why do I need a prior authorization? What does that mean? So I'll just touch on it in the last couple minutes. So prior authorization is essentially saying your doctor writes your prescription and your insurance company says, all right, well, we want prior authorization. So your insurance company is going to reach out to your doctor and say, all right, you need to give us all of this information so we can decide if we think that this treatment, medication, screening, exam is medically necessary. So it's a weird little conversation between your insurance provider and your doctor's office. It doesn't really make any sense to me because obviously as your doctor prescribed it, there's some sort of medical necessity to it, but always make sure that, you know, any prior authorizations get handled by your doctor's office. And that's just essentially what a prior authorization is. And I know that confuses a lot of people. But so just so that you have that knowledge. But I'll stay here for any other lingering questions. Thank you guys so much for your time. I really hope that I was able to clear some things up. Here we go, another question. If someone doesn't have health insurances, do you know any services that can help low income people? Yeah, so that's gonna be things like Medicaid. So you can see if you hit that, if you hit the requirements to get Medicaid at either no cost or low cost. So that's probably going to be your #1 place to look there. But I'll also stay on for any other questions. That was a really good question. Thank you for that. And real fast, I just want to ask if you could drop a number 1 through 5, how you're feeling a little bit better now, if you're feeling any better now, if you're still at the same one being you're not confident in your health insurance knowledge, and 5 being you are. If you could just drop a number for me, that'd be great. Yay!
Stephanie, there's one more question above that. Where should we look for the certain type of health insurances? Like where to kind of, you know, find the right type for you, maybe?
So when you are in the marketplace, it will have all of the information there. If you're looking through the marketplace, if you're going through your employer will provide you the different definitions, lay out all of the different benefits for each of the plans, and you can do that. And that'll have all of the different like certain type of health insurances. But if you mean sort of like the EPO and the POS, you can find information on those two for at the health insurance or healthcare.gov. It'll have it in the glossary there. I hope that answers that question. But if you're looking for like certain types of health insurance, you know, when picking your plans, you should have access to the benefits of what it looks like in order to pick what's best for you.